Hello, my name is Dr. Carlo Carandang, and I'm a psychiatrist. Today, I will answer a question about what medications help for social anxiety disorder, also known as social phobia. There are a few options for medication treatments for social anxiety disorder, also known as social phobia. Social anxiety disorder is a type of anxiety disorder where you have an extreme fear of social scrutiny. So when you have social phobia, you have a fear that people are making fun of you, or you have a fear of embarrassing yourself when you are exposed to groups of people. So the medication options that can help for social anxiety disorder include things such as antidepressants. Specifically, the classes of antidepressants which help for social anxiety disorder are SSRIs, otherwise known as selective serotonin reuptake inhibitors such as Zoloft, Prozac, and Paxil, and also a group of antidepressants called the SNRIs, also known as serotonin norepinephrine reuptake inhibitors. Examples include Effexor and Prestique. So SSRIs and SNRIs are two classes of antidepressants that are helpful for social anxiety disorders. And actually, these two classes of antidepressants are first-line treatments for social anxiety disorder if your doctor is considering a medication option for treating your social phobia. Now, other options for treating social anxiety disorder include, so let's say the SSRI or the SNRI, maybe it doesn't work, or maybe it has a partial response. So if it has a partial response and it helps a little bit for your social anxiety but not completely, then your doctor might try adding a benzodiazepine such as Klonopin, also known as clonazepam, which can augment the effects of the SSRI to help decrease your social anxiety until the point where cognitive behavioral therapy or the SSRIs or SNRI then becomes effective weeks later. Because you have to remember, when you take a medication such as an SSRI or SNRI for social phobia, it can take up to 8 weeks for the antidepressant to have full effect for your anxiety disorder. So until the SSRI or the SNRI takes full effect up to 8 weeks later, then your doctor might try adding a benzodiazepine so that it can reduce your anxiety levels right away until your antidepressant becomes fully effective. And then at that time, your doctor can then decrease and discontinue the benzodiazepine. Now, the reason why benzodiazepines aren't prescribed first line or prescribed long-term for social anxiety disorder is that benzodiazepines have multiple side effects, and you can become addicted to the effects of benzodiazepines. And also benzodiazepines are highly sedating. They can cause tremors. So there's just a lot of problems with benzodiazepine use long-term. So when doctors prescribe benzodiazepines, it's only meant to be short-term, only until the other primary treatments become effective, such as the SSRI or SNRI or cognitive behavioral therapy. So cognitive behavioral therapy is actually something that everyone with social anxiety disorder should be participating in, as CBT is quite effective for decreasing the anxiety associated with social anxiety disorder. So another medication that is used for a type of social anxiety disorder called performance anxiety, which is also known as stage fright. For performance anxiety, which is having an extreme fear of performing in front of an audience due to your fear that you might embarrass yourself or that they might make fun of your performance. So this is known as performance anxiety or stage fright. So the social anxiety you feel only occurs when you are delivering a performance. So these are discrete episodes of social anxiety. It doesn't occur all the time, it just occurs when you're in front of an audience. So for performance anxiety, there is another type of medication that is helpful, which are called beta blockers. So beta blockers include medications such as Propranolol. And what this does then is that the beta blockers blocks the effects of adrenaline so that you do not get the physical symptoms of anxiety when you are performing in front of an audience. So for a type of social anxiety disorder called performance anxiety, Propranolol can be effective for reducing the physical symptoms of anxiety on an as-needed basis when you are delivering a performance to an audience. So for performance anxiety, you can take Propranolol 10 to 20 milligrams 1 hour before your stage performance so that you don't get the physical effects of your voice quivering or your legs trembling or your heart beating fast. So these are all things that can get in the way of you having an effective and successful performance. So Propranolol can be used on an as-needed basis for performance anxiety. So in summary, social anxiety disorder can be treated with antidepressants such as SSRIs and SNRIs as primary treatments. And if you only have a partial response to the antidepressant, then your doctor may consider adding a benzodiazepine to augment the response of the antidepressants until they are fully effective weeks later. And then at that time, when the antidepressants are fully effective, then your doctor can then discontinue your benzodiazepine. And of course, for a specific type of social phobia called performance anxiety disorder, then beta blockers such as Propranolol can be helpful on an as-needed basis to help decrease the physical symptoms of anxiety while you are performing in front of an audience. I hope this answers your question. Thank you for listening. I'm Dr. Carlo Carandang.